Welcome to Sreya Hospital and IVF Center, where we care for you every step of the way on your journey to parenthood. Today, let's explore a fundamental aspect of pregnancy, the due date. But what exactly does due date mean in pregnancy? Your due date, also known as the expected due date or ED, is a crucial milestone during your pregnancy journey. It's the estimated date when you're likely to give birth to your baby. Pregnancy typically spans around 280 days, which is equivalent to 9 calendar months and 7 days, or 40 weeks. However, a pregnancy is considered full term at 37 weeks. The actual duration can vary and often falls between 37 and 42 weeks. Now, let's delve into how this important date is calculated. For many expectant mothers, pinpointing the exact moment of conception can be challenging. Unless you've been actively tracking your ovulation, it's hard to determine when fertilization occurred. Here are some methods to calculate your expected due date. 1. First day of your last period. The most common approach is to count 40 weeks or 280 days from the first day of your last menstrual period or LMP. This is what our due date calculator uses to estimate your due date. 2. Conception date. If you know when you conceived, usually about 2 weeks after your LMP, you can calculate your due date based on your conception date. However, it's important to remember that fertilization may not occur on the day of intercourse. But what if you don't know your LMP or conception date? Don't worry, help is available. Simply consult with your doctor. They can perform a checkup and recommend an ultrasound scan, which will help determine how far along you are in your pregnancy and provide an accurate due date. For those who have undergone in vitro fertilization or IVF, calculating the due date follows a slightly different path. If you had a day 5 embryo transfer, count 261 days from your transfer date. For a day 3 embryo transfer, count 263 days. Your dedicated medical team will calculate your expected due date on the day of your embryo transfer. As your pregnancy progresses, a dating scan will refine this estimate based on your baby's size and development. Remember, while due dates are valuable, they're not an exact science. Only about 4% of babies are born on their due date. Several factors can influence due date accuracy, such as irregular periods, uncertainties about conception, or if you don't remember your LMP. To get a more precise idea of when your baby is likely to arrive, your doctor will perform a dating and viability scan, typically between 6 and 9 weeks into your pregnancy. Ultimately, what matters most is that you're well prepared for the beautiful journey of labor and welcoming your new baby. At Sreya Hospital and IVF Center, we're here to support you at every stage, ensuring the health and happiness of your growing family. Contact us today, and let us be a part of your remarkable journey. Sreya Hospital and IVF Center, where every baby's arrival is a celebration of life.